Go ahead.
Ready? So before we get started with anything, I thought it'd be fun if we played speech language pathologist. What's going to happen? We'll just pretend we're at the water cooler at work talking, and I'm telling you about my client. Her name's Lily. She's 15 years old. She was born 1 month premature. She spent 2 months in the NICU, which is kind of like a little baby facility to help babies get big and strong so they don't I explained that poorly. Anyway, and then we have endotracheal tube for respiration. That's what she has. I'll explain that later, but it pretty much is a tube that goes through your mouth and to your lungs and helps babies breathe. And then she also has a G-tube for feeding, and that's just a tube that connects right to the stomach, and you can put food in there so they can be fed. Now the parental concerns, she's still on a G-tube, but does not have an endotracheal tube. She cries when food is presented to her, so the food's just laid out on the table. She starts crying. She will not eat or drink. Everything's done through the G-tube, and if food is put on her mouth or in her mouth, she vomits. So, speech therapists, what do we think is going on?
Well, she obviously doesn't know that food is presented to the mouth. So
maybe
it's
like
a very, very unnatural thing for her to experience that.
Mm-hmm.
So she's probably rejecting it in the only way that she knows how.
Yes, that's good. That's good about sensory. Do you guys think any of these are like major concerns that stick out to you?
Well, I mean, she's basically bulimic at this point, so.
In other words, yes. What would you target if we were to do therapy? If you just had to guess, I know this is just like throwing this out there, but what do you think is a big thing we should target?
How would you get off of the G-tube? Would
Good.
you maybe
Yes.
like introduce food like and doing both? You know what I mean? Like doing that just so like she gets sustenance and then like saying, hey, you know, this is really what you do.
Mm-hmm.
And then just slowly
Like start with a
going
cracker or something.
Yeah,
Yeah.
fantastic. That's a great thing to target.
But she's crying when food is presented.
Yes, but we had to find that really nice way to transition.
She doesn't even want to see it.
And one last question. Do you think this is within our scope of practice? We're speech therapists. What do you think? Would we get our license taken away if we do help out this child? Or do you think
probably like throat swallowing associated at least. So
Mhm.
yes, that falls under your scope.
Okay.
I would say not solely, but to be involved,
Yeah.
I would say yes.
No, yeah, not the only person involved in that. Yeah.
Okay, how would you like to be involved in it?
Well, I mean, just with the movement and getting yourself to actually swallow the food.
Okay,
Like teaching them how to do that.
good, good. Those were fantastic answers. We're going to see Lily later on. She'll come up frequently throughout this presentation. But we'll move on. 2 fundamental facts. So to talk about the speech language pathologist scope of practice, it actually is within our scope. But first, before we talk about that, I want to talk about how the DSM, and that's kind of like the diagnosis Bible, how you diagnose something. What they say a feeding disorder is. They say it's a persistent failure to eat adequately as reflected in significant failure to gain weight or significant weight loss over at least 1 month. And now ASHA, and those are like the speech therapy gods, they say that it is within our scope to help such infants. It's a speech therapist position to select and systematically implement intervention strategies appropriate to communication, hearing, speech, language, emerging literacy, feeding, and swallowing needs of the child. And here's a fun fact. As many as 20% of families have feeding concerns, and 80% of families have feeding concerns when there is a developmental disability. So that's an important thing to keep in mind as we go through this presentation. Also, we should go over typical feeding development. So right here, we have birth to 4 months. The texture that they're going to be having is thin liquids. And thin liquids, that's going to be from do you call that, from the breast or the bottle, just plain old milk. They're going to be fed about 2 to 4 ounces. That's a little bit less than those tiny bottles of water, 6+ times a day, and that's a huge amount of times per day. Our next age we're going to look at is 4 to 6 months. They're on a parade diet, and that's a little bit thicker than our thin liquid, and that kind of goes along with jarred baby food, and they're still going to get their bottle. And as we can see, they're going to be fed a little bit more, but less frequently throughout the day. Our next age is 6 to 9 months, and they will be on a pudding texture. And now that doesn't mean that they're fed straight up pudding all the time, all day long. They're fed a pudding texture, so you can put the spoon and then it kind of globs off. So we're talking about yogurt and like applesauce. And we can see the bottle is now kind of being replaced by oral nutrition.